So Professor Charlotte Pissinger, welcome to Edinburgh, and it's a great delight to have you here.
Thank you very much.
And thank you for agreeing to speak with us about some of the things that you're seeing in the tobacco control space. I wonder if we could start by taking you back to how you got into this area of work.
Well, I'm a medical doctor, and when I was a young doctor, I worked for 4 years in a department of pulmonology, lung disease, and I realized that we could actually close these 4 departments if it wasn't for smoking, that all these people, they were dying because of tobacco. And there were a lot of people that when they were dying, they hold my hand and they told me it wasn't worth it. Go and tell the young people never to start. And it really impressed me. So I wouldn't say I took the decision at that time, but it started there. And there I got education as a smoking cessation counselor. And I started to counsel people to quit smoking. Then I took a PhD that was on smoking cessation in the general population. And in the recent years, I have worked more and more with trying to influence politicians to make a legislation that makes it more difficult to start smoking and easier to quit smoking.
And how has that been going in Denmark?
It has been quite a struggle, but I'm very optimistic. In the last years, actually, some things, very positive things has happened. For many, many years, we were really depressed, us that were working with smoking in Denmark, because tobacco control was very difficult. Copenhagen, the capital of Denmark, was also where the headquarters of Scandinavian Tobacco Company were situated, and there was a lot of lobbyists that were, working on our politicians. So it was very, very difficult to get any legislation in tobacco control. So Denmark was one of the last countries to implement smoking bans, and Denmark was also making obstructions, so we in the European Union couldn't move on with marketing bans, for example. So it was a very difficult country to work in the tobacco control field. Other things worked well, such as the smoking cessation activities. We have had for many years or decades national smoking cessation services that are for free. And we have a national database where we register all the smoking cessation activities. So this was in place, but the legislation was very, very weak. But then after 7 years with stagnation in the smoking rate in Denmark in adults, and then came actually an increase in smoking rate in adolescence, there was a movement in Denmark where we had an alliance called Smoke Free Future with the Danish Cancer Society and the Danish Heart Association and Medical Association being very active, and the civil society too. And there was kind of uprise bottom up, where people were actually demanding their politicians to act on it, because it scared them that after so many years with slow but steady declines in smoking rates, young people were starting smoking again. And in 2020 or in 2019 there was a new government, and they said as the first thing that we will act on tobacco control. We will have a smoke-free generation in 2030. No young people should start smoking. And a lot of things were implemented. We got plain packaging, we had a display ban, we had a ban on flavors in e-cigarettes, we had age restrictions on nicotine pouches. There were a lot of things that came into place, and most important of all, there was quite a steep increase in taxes, tobacco taxes also. So, and that resulted in that we actually saw a decrease in sale of tobacco, and we saw a decrease in adolescent smoking. So it was effective what the politicians did, but unfortunately at the same time there was a very strong influence on implementing or selling nicotine products to young people. So what we have seen in the last year is that the rates of use of nicotine pouches, e-cigarettes, not so much heated tobacco, but it's also on the rise. They were all going up, and now there is we have 35% of the Danish young people, they are using a tobacco or nicotine product daily or occasionally, which is dramatically high, I would say. So on one side, we are very optimistic because we have actually reached the politicians and we are in dialogue with them, and they have also recently done some more legislation to enforce the law better. But it is a struggle with the new products.
Do you think the industry might be behind that struggle, that force?
Oh yes, they are very, very active. We have seen in the last years that Philip Morris has been invited twice to speak in the health committee in the parliament to present their harm reduction products, or so-called harm reduction products. And I have never experienced that the tobacco industry would be invited to speak in the health committee in a parliament in Denmark. So doors are being opened now that were closed before, because the industry now can claim that they have products that are less harmful, that they are a part of the solution of the tobacco epidemic. They also have access to, for example, the Danish Medical Journal. They had a whole page where they were writing about how wonderful these new products were, and all doctors should prescribe them in order to decrease the social inequality in health. They frequently have whole page articles in major newspapers where they are attacking us in the that work with tobacco control for being moralists, for being narrow-minded, prejudiced, and undermining, for example. Also, they have personal attacks on me and some of my colleagues, and they are again claiming that they have products that are benefit for the population, for the smokers, because they don't want to talk about population, they want to talk about smokers. Yeah.
And do you think the evidence supports what they're saying or not?
No, evidence is definitely not supporting what they are saying. I must say, first time I heard about e-cigarettes at a conference many years ago, 15, 16 years ago, I was very excited because the idea of a product that would appeal to smokers and a product that was harmless, because the first toxicological reports I saw, they were really optimistic. It was like, wow, there are no toxins, there are no carcinogens. It is wonderful if we can get all smokers switched to these products. But from then, we now have thousands of studies. We have studies on the vapor, we have in vitro studies with cells, we have animal studies, we have experience with humans, we have surveys, observational studies in populations, and so on. So we have a lot of evidence. And I must say there is really a good reason to be concerned, because all the biological effects have been described now, many of them, how, for example, e-cigarettes are harming the body. And now we also start getting some of the longitudinal data where we have a follow-up on people over longer time, so we can also see what kind of diseases will come. And both when we look at the biological effects and the diseases that we see in animals and the first sign of diseases in the human experiments, and now also in the studies that follow people over time, they are showing that e-cigarettes will harm the lungs, they will harm the heart, they have other harms too, a lot of different harmful effects. So I think we shall really be cautious. And this is, of course, the greatest worry is for the people that had no risk at start, because when we are talking about harm reduction, the industry always wants us to talk about the old, reluctant smokers, unable, unwilling to quit. So their harm is 100%, and maybe they could have a little reduction in harm. But for the non-smokers, for the young people, for children, there is an increase in harm. There is not a reduction in harm. So there is an intergeneration trade-off. These products could maybe have a little potential of helping a few people, but they have a huge impact on those who are not smoking, and it is harming them. I have no doubt today that these products, they will harm young people. And we can see that the industries, on one hand, they are telling the politicians and the population that these products are developed to help smokers to quit. But it is not what we see, because all their marketing is aimed at young people. And that is also what they tell their shareholders. They tell them that our mission is to stimulate the senses of young people. It is not to help old smokers switch to a less harmful product. So they are paying young influencers to spread these products to young people. They are paying shop owners to place these products next to the counter, just next to candy. And they are, when the influencers, they are promoting these products, they are comparing them with candy. It is like hashtag sweet lover, as promoting IQOS, a heated tobacco product. So these products are sold to the politicians and the population as smoking cessation products, but not one of the products have been registered as a smoking cessation product. There is no manufacturer that has asked for their brand to be registered as a smoking cessation product. And I think there are two reasons for that. First is that maybe the evidence that it is both effective and safe, they don't have the evidence. But I also think it is because if a product is registered as a smoking cessation product, it's not so sexy. It's not appealing to young people. And they want it to be a consumer product. It should be compared, the young people should associate with candy, not with smoking cessation.
Yes. And I've heard them claim that nicotine is benign, it's like caffeine, but you've looked at some of the research around nicotine, haven't you?
Yes, we made some research in Denmark and we have published a report on that. And we concluded that there is moderate evidence that nicotine is harmful to the immature brain, that nicotine is of course very addictive, but it is also harming the cognitive function. So people have difficulties, they have learning, memorizing, concentrating. They have an increased risk of mental problems such as anxiety and depression. They have greater difficulties tackling stress. They get more stressed, and they have lower self-control. And also nicotine seems to be a gateway drug, so nicotine increases the risk of taking up other drugs such as alcohol, cocaine, hash, and so on. And this is actually nothing new. It is not a conclusion that we are making in Denmark because we are stupid Danes, but actually this is exactly what the Surgeon General concluded in US also in 2016, that nicotine poses a serious threat to the immature brain. And we should really take it seriously.
Thank you. So just a final question. Ash Scotland is celebrating 50 years of activity and pushing for measures to control the industry and the products and trying to support people to move away from tobacco and related products now. Is there anything you'd want to say to us for the next 10, 20, 30 years?
Well, I think you are doing very well here. So, in general, I would say that you should really try to convince your politicians that they should not trust the industry. They are claiming they want to be resocialized. They are claiming that they are not how they used to be. that these products, they will do good for the public health, but never trust them. They are wolves in sheep's clothing. That is the most important thing, I would say. So keep on your good work and strengthen your legislation as much as possible. We now have evidence from e-cigarette research. There are almost 30 studies that actually showed that flavor restrictions, they do decrease use of e-cigarettes in young people, and that taxation decreases e-cigarette use in adults. And we know also from US studies that states where they have a 24-year plus restrictions on sale of e-cigarettes, that the use was stagnated. It didn't increase or decrease, whereas in the states where they didn't have this 21-year plus restriction, the use in young people increased. So these age restrictions, they prevented an increase in use. So legislation works just as it worked with tobacco control. It works with these new products, and we should use legislation as much as possible, because that are the frames for the young people. That is the world they are navigating in, and we should make it difficult for them to get access to these products. They should not be tempting, they should not be cheap, they should not taste of candy. So
thank you, that's been tremendously helpful. Thank you very much for your time.
You're so welcome, and good luck with everything.
Thank you.